Myositis ossificans is an aberrant reparative process that causes benign heterotropic ossification in soft tissue. Heterotropic simply means that it's extraskeletal in nature. Basically, you're getting bone deposition within muscle tissue. Common sites for MO include interfascial planes, they're intramuscular, they may be found in areolar tissue or fat, and in periosteum. Common areas of myositis are quadriceps, the deltoid tuberosity, and anterior elbow. Myositis is going to occur when you have muscle contusions that are sufficient to cause tissue damage and vascular disruption. This causes two different types of injury. You may end up with an intermuscular hematoma with septal or fascial sheath hemorrhage that is more likely to disperse and cause distal ecchymosis. You may also end up with an intramuscular hematoma, and this is an injury that resolves slowly and is associated with myositis and scar tissue. The mechanism of myositis is a compression wave due to a direct blow. This can be either an acute incident or it can be a chronic component to MO. Another mechanism is individuals who continue to play after an injury. It can be due to passive forceful stretching or it can be due to re-injury. Initially, the person will notice a fluctuant hematoma and edema, as well as ecchymosis in the area that they have been hit multiple times or they have injured in the past. In the end stages, you will find a hardened mass, which is due to the calcification. Additionally, there will be localized pain, and the person will become dysfunctional in that muscle. When we are looking at myositis in the quad, there will be decreased active and passive range of motion at knee flexion. There will also be decreased active and passive range of motion for hip extension, especially if there is rectus involvement. Diagnosis is going to be through an MRI, an ultrasound, or bone scintigraphy. This is when a radioactive substance is injected into the body so that they can see that mass that has occurred. X-rays are going to usually be positive within 3 to 6 weeks post-trauma, just as you would see with a stress fracture, for example. Treatment-wise, once myositis has formed, it could take up to a year to reabsorb. There will be a decreased risk of MO formation with rest and proper treatment after trauma. Again, this is just to help with the reabsorption of the hematoma. Differential diagnosis to be aware of includes osteochondroma, osteomyelitis, fibrodyspasis, which is a myositis ossificans that has become more progressive, and malignant lesions such as osteosarcoma and chondrosarcoma.